And we now talk to Health Undersecretary and Treatment Czar, Leopoldo Vega. Good morning, sir. Thanks for taking our call.
Good morning, Ray. Good morning to all the listeners of CNN.
Sir, can you tell us more about the situation and utilization rate in these high-risk regions? I'm talking about the Western Visayas, Caraga, Davao, and Soxargen. And what factors do you look at? What are the parameters for labeling an area high risk?
All right. You've seen, on a national perspective, we've seen a gradual trend here in the national capital region. But in the provinces, most specifically Region 5, Western Visayas, that's Region 6, Negros Occidental and Oriental, and Caraga and Southern Mindanao, they've been labeled as a high risk on the metrics of the average daily attack rate and the two-week growth rate. These were computed, and it seems that the average attack rate is still high, together with the high two-week growth rate. And besides, there are areas specifically in Negros Occidental, Oriental, and Region 5 and Caraga, most specifically also into one area, that's Region 13, wherein the HCUR, or the healthcare utilization rate, is in a high-risk position. So we look at these three metrics to label and classify whether the region is high risk or low risk. But here in Metro Manila, we are now in the low risk position.
All right. Now, for the high-risk areas, sir, what are the main challenges that they're experiencing? What does it look like on the ground? Do they have enough supplies and healthcare workers?
The challenge really is to make sure that they will have the capacity for critical care beds, no? And they should be able to allocate it at once, since you know very well that severe and critical cases can easily increase our case fatality rate, and it is therefore of utmost importance that they get the proper treatment. So we are providing them with enough in those regions with resources like mechanical ventilators, BiPAP machines, and high-flow nasal catheters, and also healthcare workers through the regional office, wherein they can actually be deployed or assigned to areas where there is a gap in terms of their resources.
Regarding the deployment of healthcare workers, are there enough to meet the needs of the high-risk areas right now?
Right now, we are trying to make sure that the number of positions that we have given to the different regions across the Philippines, that's actually the emergency hiring, that's almost close to 11,000 positions. And roughly about 93% of these positions already has been filled in. And we are still looking for ways to, of course, augment the different hospitals in terms of the healthcare workers by asking for deployments coming from different agencies and even recruitments from other provinces to be deployed in those areas.
All right. Now, there is some good news here. Of course, you were saying that Metro Manila is now categorized as low risk. What are the parameters for putting an area under low risk? And what can we attribute this to? What has Metro Manila done right to put itself in this status?
Well, Metro Manila, at the start of April, went into an escalation of the quarantine positions. We started ECQ and then MECQ and GCQ with, of course, with the heightened restrictions. And this brought about the compliance in the implementation of the detection, testing, and tracing. And definitely this actually lessened the transmission. And we have seen that the two-week growth rate has also gone down, together with the average daily attack rate. And most importantly also is the utilization of the healthcare beds for specifically for COVID utilization rate, and now in the low risk position. And even with the intensive care units across Metro Manila, we're now in the low risk position. So that's the I think the main thing that happened here in the Metro Manila is we heightened our quarantine position, slowly, gradually transitioned to de-escalate until we were able to make sure that the compliance implementation of the detection trace is there. And of course, the local government's component and in terms of and contribution in terms of this with the vaccination that's also going on.
Okay. Another development in this pandemic, of course, is the emergence of this Delta Plus variant. We don't know a lot about it. We know that it seems to be more contagious, and it appears to bring about more severe symptoms. How ready are we for this Delta Plus variant, Yusek?
Well, the Delta variant is really something that we have to fear because that has been noticed globally and specifically in India, wherein it caused a big cases of morbidity and mortality of all the new cases that were seen in India. And that's the reason why we really have to be very strict in our border control, making sure that returning passengers coming from abroad must be able to be quarantined on a 10 days plus 4, meaning 10 days quarantine and 4 days after you have a negative test on the 7th day. So this is really very important that we are able to control the entry of the Delta variant, because so far, with the sequencing of the positive samples coming from the UP genome, we still have not seen a local positive case for the Delta variant here in our country. So it is the utmost important that we have to keep it at bay and make sure that we are also very prepared in terms of our isolation facilities, testing, and even the hospitals if ever there would be another surge because of this. But definitely we need to scale up with our vaccination, because this is the only way that we can do it, with implementation of the PDITR and, of course, scaling up the vaccination. This will actually now protect the community.
All right. Thank you for your time this morning. We appreciate it. That was Health Undersecretary and Treatment Czar Leopoldo Vega. Aside from